Let's move on to what we booked you for, sir. Let's talk about the turnaround, the closing of bars, restaurants, and the like. Should this have happened sooner in your state? Should Texas have not even reopened to begin with, to the extent that it did?
This is very sad for me because it didn't have to happen this way. The governor was warned months ago that we were facing a looming potential health crisis, and he absolutely wanted to do nothing about it. I was on a conference call that all members of the Texas congressional delegation were invited to, and state reps as well. And I asked him a question about the churches, because there had been a report that there was a church in Sacramento, California, in the early days of coronavirus, where there was one person that attended a church service and made about 40 other people infected from one church visit. And I asked him, I said, what about the churches? And he says, well, we're just going to let the ministers decide on their own. They don't want to make their parishioners sick. And it is that sort of weak leadership that he showed from the very beginning of the COVID-19 pandemic that has made this absolutely worse. This is, he knew it was going to be catastrophic. He was warned that it was. We have some of the leading epidemiologists and allergists and infectious disease specialists in the state of Texas from our public and private university system here. And he absolutely ignored all of their warnings that this was going to get out of control. And he decided that he was going to follow Trump, who downplayed this and said it was being used to harm him politically, to our lieutenant governor that said that we should allow old people to die, to a hairstylist in Dallas that was always playing the governor so she could figure out a way how to use the pandemic to line her pockets with money. And those were the people that he listened to instead of the health experts that told him this is going to get out of control. And what I'm hearing about hospital beds being overrun, children's hospital beds having to be used, that should be reserved for our young people that get sick. Texas is not the place that you want to have an accident that's non-COVID related right now. Because it's going to be hard for you to get treated.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.